Amoxicillin is a commonly used antibiotic for treating bacterial infections in racing pigeons. As racing pigeons are highly active birds that are prone to various injuries and stresses during training and racing, they can be susceptible to bacterial infections that require antibiotic treatment. Amoxicillin is a beta-lactam antibiotic that works by inhibiting bacterial cell wall synthesis. It is considered a broad-spectrum antibiotic that is effective against a wide range of gram-positive and gram-negative bacteria. When should amoxicillin be used in racing pigeons? Amoxicillin is primarily used to treat common bacterial respiratory infections in pigeons such as mycoplasmosis, ornithosis, paratyphoid, and salmonellosis. The signs of these respiratory diseases include discharge from the eyes and nose, sneezing, labored breathing, and loss of appetite. Amoxicillin is also sometimes used to treat infections of the digestive tract, reproductive tract, and skin in pigeons. Veterinarians may prescribe amoxicillin when bacterial cultures or staining tests indicate susceptible bacteria as the cause of infection. Amoxicillin is most effective when the infection is treated early before it becomes systemic. Prolonged, chronic infections may require longer antibiotic treatment. It is important to complete the full course of amoxicillin as prescribed by the veterinarian even if the bird seems to recover fully after a few days. Stopping treatment early can lead to recurrence of infection. Administering amoxicillin to racing pigeons. Amoxicillin is available as tablets, capsules, or oral suspensions for pigeons. The most common dosage for amoxicillin in racing pigeons is 20 to 50 mg per kilogram body weight twice daily. The exact dosage and duration of treatment should be determined by the avian veterinarian based on the type and severity of infection. Many pigeon fanciers have success mixing powdered amoxicillin in the drinking water. This ensures the birds receive the medication dosage evenly over the day. However, the proper concentration needed in the water depends on the number and weight of birds drinking from the water source. Measuring out the exact dosage for each individual bird with tablets or injections administered directly into the mouth or muscle is more precise. Amoxicillin is better absorbed on an empty stomach, so dosing at least an hour before or after feeding is optimal. The water consumption of sick birds can be variable, so monitoring their intake is important to ensure they receive adequate medication. Avoid using metal and plastic containers to mix amoxicillin solutions as the drug can adhere to these surfaces. Potential side effects of amoxicillin in pigeons: digestive upset, vomiting, diarrhea, loss of appetite, hypersensitivity reactions, itchiness, rashes, anaphylaxis, antibiotic-associated colitis, from disruption of normal gut bacteria, drug interactions, with certain medications like methotrexate, probenecid. To reduce gastric upset, many vets recommend combining amoxicillin with the antacid aluminum hydroxide. Yogurt or probiotics can also help normalize the gut microbiota following antibiotic treatment. Close observation and monitoring for signs of adverse reactions is prudent when administering any antibiotic to racing pigeons. Advantages of using amoxicillin in racing pigeons: broad-spectrum antibiotic effective against common respiratory infections. Typically well tolerated with minimal side effects. Convenient oral administration once or twice daily. Cost-effective and readily available antibiotic. Absorbed quickly, reaching therapeutic levels in the body. Can often notice improvement within 24 to 48 hours of initial dose. Shorter treatment periods, 5 to 14 days, compared to other antibiotics. Achieves high concentrations in the bloodstream to fight systemic infections. Potential disadvantages or limitations: not effective against viral infections. Some bacterial strains have developed resistance. Requires repeat cultures to confirm susceptibility. Extended or overuse can lead to superinfections. Not useful for certain severe deep-seated infections. Can alter gut microbiota at high doses or long-term use. Allergic reactions possible in sensitive birds. Exact dosage in water can be difficult to determine. Overall, when used responsibly under the guidance of a veterinarian, amoxicillin is considered a first-line antibiotic for treating common bacterial infections in racing pigeons. However, proper diagnosis, close monitoring, and following treatment guidelines are important to ensure safety, efficacy. There are many reasons to buy my racing pigeon method. Here are some of the best reasons. You will get excellent results. It's a very simple system to use. It's affordable. I have had over 400 first prize winners. It's adaptable to any situation. You can use it with any racing method, natural, widowhood, young birds. It's a very effective method. There is no need to spend a lot of money on fancy pigeon products. It's a reliable system and it is foolproof to use. Professional athletes, race horses, take the same products. There is science behind this, not just hearsay. It is all to do with red blood cells and oxygen in the blood. Without that, a pigeon will not race well, or an athlete will not win a race. If he has low oxygen in his blood, the above is fact and is 100% science. There are a few things you can do to improve your chances of winning at racing pigeons. One of the most important things is to learn as much as you can about the sport. You'll need to know the different types of pigeons, how to train them, and how to race them. Another key factor is practice. You'll need to be able to fly your pigeons competently in order to win races. And, of course, you'll need to have the funds to invest in racing pigeons and other racing equipment.